We'll just start the meeting. It's 9. So
Okay.
for everyone who's watching this, maybe after the recording as well, after it has been recorded, Kumar is going to talk about FHIR in India, an implementer's perspective, and we'll be taking questions after. Good luck, Kumar.
Yeah, thank you. Thank you, Chris. Hi, welcome everyone. Today I'll be talking about FHIR in India. This is Kumar Satyam. I work at Kakinos Healthcare, and I'm responsible for building a distributed cancer care network which connects multiple hospitals, labs, and clinics to have a seamless data exchange. I also lead the technical committee at HL7 India, and I'm an active member of the FHIR India community. So prior to getting into the FHIR specifics, it's important to understand what's the healthcare ecosystem of the country like. So if you see, India is a vast country. It has 1.4 billion population, and it's catered to by about 200,000, more than 200,000 healthcare facilities, and who are catered by more than 2,000 plus healthcare IT vendors. Now, what you can see here is there is an ecosystem of very small fragmented subsystems. So there are many subsystems which constitute or make the Indian healthcare ecosystem, right? So, and if you see, the majority of the healthcare spend is in private sector, whereas the public sector still is around 20%. 20%. Okay, so what this brings up are like several challenges into the ecosystem, or several challenges in the system. So some of the challenges which comes because of such a diverse and fragmented ecosystem is like disparate entities catering to disparate needs, and which leads into data silos, which leads into workflow silos, right? Constructing a longitudinal patient record becomes very difficult because of different identities, different geographies, right? And then there are a lot of care providers, for example, government schemes, then NGOs, then private sector. They are all running their own schemes to the welfare of the population. But each one of them is running on their own, right? And they are not connected, right? So those are some of the challenges that are there in the ecosystem. And as a result, most of the healthcare today is reactive and not proactive, right? The focus is more on treatment and not on prevention. So having all these things in mind, the government of India, a Ministry of Health and Family Welfare, constituted a committee to come up with a national health policy, which would talk about the digital adoption or digital roadmap for the healthcare in the country. The goal of it was to promote preventive and promotive health care orientation through digital construct. So in 2017, they talked about registries, federated architecture, data standards, electronic health records and all. And in 2019 is when the first blueprint came out, which mentioned the specific use of FHIR R4 as the data exchange standard. And specifically for any health data to be transmitted across the network, FHIR would be used. That was specifically called out in the 2019 blueprint. It also talked about layered framework and other things. And finally, in the middle of the pandemic 2020, the pilot of ABDM. ABDM is Ayushman Bharat Digital Mission, which is one of the largest digital health initiatives in the world, was launched. And post the success of the the pilot, the national rollout of the program was done on 27 September 2021. So what does ABDM do, or what does the Ayushman Bharat program does? and how is it promoting the interoperability and the digital adoption, right? So one of the first problems that any interoperable ecosystem with disparate systems or disparate entities has is the unique identification of people, places like the providers and hospitals, clinics, and even drugs and other things, right? So the first construct of ABDM is actually the rollout of nationwide unique identification of these things, right? Primarily the ABHA. ABHA is for patients, for people, right? So far, 400 million ABHA numbers have been rolled out. So a person carrying an ABHA number can be uniquely identified across any healthcare system within the country, right? The next one was about federated health record, which means that India has chosen the method of having health records stay at the source, but can be leveraged and transmitted on demand, right? So that's the federated health records ecosystem that has been built. And the patient is in control, which is the PHR app. So the ownership lies with the patient, okay? So the patient can approve, deny, or even approve, deny, and request for health data from any of the healthcare entities that the patient has visited, right? And then the health data exchange actually happens in FHIR format, okay? Then there is a service discovery and service fulfillment, that is UHI. Registries we already talked about. And then there is the health claims, digital health claims platform that has also been rolled out, which is also fully FHIR compliant, means all the artifacts, all the resources are in FHIR R4 format, okay? So as I said, if you had paid attention to it, I said like the FHIR artifacts are, the documents, the records are in FHIR format. What it means is India has chosen to use FHIR resources, FHIR documents, FHIR bundles, okay? But the APIs are developed by the National Health Authority, right? So the APIs are not FHIR, but the payload and the data exchange is FHIR. So on this slide, if you see, the FHIR documents that are listed to be exchanged today are prescription, diagnostic report, consultation, discharge summary, so on and so forth, right? So these are the health documents that can be exchanged over the ABDM network as of today. And there is a robust developer documentation, developer sandbox, and FHIR IG that has been published and maintained by the government, right? So far, if you see, there are like around close to 1,000 healthcare IT vendors who have applied for these to get on board with this, and soon we will have most of the ecosystem compliant with FHIR requirements, and hopefully in few years' time we will have an ecosystem which is able to exchange, understand FHIR, okay? So on the right hand side, you see the health claims exchange FHIR profiles. So these are the two national profiles that are there in India. One is about the PHR, the federated health records, and the second one is health claims exchange. So these two are the national IGs or the profiles that are there. Okay. Now, as you have seen, and as I have told, right, the healthcare ecosystem in India is pretty fragmented, and the digital adoption is still at the nascent stages, right? So most of the guys means the EMR adoption is not that well. And so what happens because of that is creation of FHIR resources, the discrete data is very, very difficult. And since we cannot get the discrete data out of the systems, it becomes very difficult to do any kind of analytics, aggregation, or anything like that, right? So the approach that we have taken is like initially allow sharing of PDF data. Here, the example is, for example, diagnostic reports. So folks are encouraged or taught to how they can encapsulate PDFs in FHIR bundles, in FHIR composition, and send. Eventually, in a year's time or 2 years' time, once the adoption of ABDM picks up, and once folks are comfortable with FHIR, the approach is to move to discrete data, right? So that further things can happen. So that's the unstructured to structured data approach that India is taking. Okay. Now, some of the challenges from the implementer's perspective that is happening is like still there is very low awareness of FHIR. So never mind, like India has the largest developer pool for FHIR implementers in the world. However, those are all catering to the Western world, the US, Europe, and the other developed countries. But within the country, the healthcare IT providers, they have a very low awareness of FHIR. Digital maturity of the ecosystem is pretty low. The EMR adoption is pretty low. There are not many incentives, business drivers for people to adopt to interoperable ecosystem. In fact, there are fears and concerns. What happens if I share my patient records? Because still the hospitals and the providers think that patient belongs to them, right? And then FHIR training, if you see, right, is still very, very expensive, right? It's in tune of close to $1,000 or $500 euros, which translates into like a significant amount of money for the for Indians, right? So that's still very, very expensive. So these are the challenges that are there in front of us. So one of the ways to address these challenges is to build a robust, vibrant FHIR India community. That is what the HL7 India is trying to do. And it is an open community for HL7 FHIR and interoperability enthusiasts. There is no entry barrier. Anyone can come in. And the whole idea is how can we figure out ways to make the digital health ecosystem in the country more interoperable, more cooperative, and more affordable, right? Because implementing standards is still an expensive affair. Okay. So the FHIR India community, how it works is it has a lot of communication channels. So we are a loosely coupled group, and there is no formal structure, but we try to meet at least once a month. Anyone can attend and anyone can present, and it's a platform where we learn, share, connect, discuss, and solve problems. We have a social media handle called FHIR India. So you can check that out. You will see all the trending and all. And we have also created a LinkedIn group where folks can connect in. We also had a Zulip for FHIR India, but right now the Zulip trend is going down, and most of the people are comfortable getting onto LinkedIn. And for any Zulip discussions, we just redirect them to our chat.fhir.org, the global forum. Okay. FHIR India community and HL7 India is also trying to build the knowledge and the awareness through FHIR Connectathons. And the FHIR Connectathons in India are new. We first did in 2020, then in 2021. And we take up specific items which are very, very relevant to the country and try to build an awareness and build solutions, trainings around that. So we don't influence the standard as much. Right now, the focus of the Connectathons are more about educating the people, trying to get them to adopt the standard. And if you see, like there are more than 80 or 100 companies that participated, 300 plus participants, and so on and so forth. So what we are requesting from the global community, if you have best practices, if you have gone through the digital health adoption journey, if you have seen similar kind of challenges which is coming in terms of adoption of FHIR and standards in your country, we would like to exchange ideas. We would like to borrow from you how you solved it, so that we can see like if we can implement it on our side. Because once we implement for India, I think that's the final test bed for FHIR adoption, because the scale, the adoption, everything is humongous. Okay. So with that, I would conclude my session. I can be reached out in the speaker gallery for Whova app. I can be reached out on my email. Twitter and LinkedIn. Thanks everyone for patiently listening. Open for questions.
Thanks, Kumar. Are there any questions here? You have a question? I have a question. Do you see the number of attendants to your Connectathons and your meetings in HL7 India growing?
Yes, they are growing a lot, because most of the primary reason is the meetups are more educational and free, and we try to go around the cities and conduct the meetups. Okay, so we are also diversifying our if you see the map of India, now our presence is across the country, right? So it's growing. Participation in Connectathon is also growing. From the first to the second, it grew. The third Connectathon that we are trying to do is in this year. Now, one of the challenges like the costing, the pricing, right? So that's something that we have to work out, the sponsorships. But if we place it reasonably well, I think we will get, we are targeting this year around 500 to 750 attendees in the Connectathon. So that's our target for this year.
Thanks. And another question for me as well. Do you see any specific needs that's typical for India compared to the rest of the world, FHIR-wise?
Yeah, so one of the things that we saw was like that our RESTful APIs on the FHIR side, right? Those are mostly synchronous APIs, right? So, and what we have implemented in India is async APIs, right? So, which means that the requester and the responder can respond at their own timeline. So those pieces are not there well defined in FHIR spec, right? So that's something that if we can do, we can just get those. And the second thing is a lot of attributes, but those can be addressed. I think the APIs are the one thing. And then the other thing is like FHIR is becoming a little bit complicated for the folks in India to understand. It's what a simple REST JSON can do. They feel that it is becoming complex. So if we can come up with a simplified version or a simplification in terms of tooling, in terms of other methods, right? Maybe training is the main thing that is missing, right? People are feeling it's complicated.
All right. Thank you. That's all the questions, I think. Thank you very much.
Thanks a lot for hosting this conference. Thank you.
Thank you.